Hi, Dr. Alongi here, the spine doctor, and this is End Arthritic Pain. 6 easy steps to freedom from arthritis pain. You've decided to join me because you might be experiencing pain in your back, your low back, your torso, mid-back, your neck, shoulders, your hip joints, even your big toe, wherever you're having pain. It all matters big time. So I'm here to share with you, to commiserate with you, and to enlighten you. Even if you're not experiencing pain at this time, the messages and the information in this video series will empower you tremendously. Even if pain is not your current reality at this moment, even if it's intermittent, it comes and goes, you may still have questions about it and you may want to know what to do about it. These phenomenal and progressive steps that I'm about to show you today will come in really handy, and I've learned them from my 25 years of clinical experience helping happy and fulfilled patients get out of pain. And we're going to do this for our arthritic pain. And it's true that human beings are built with a lot of angles and curves, a lot of situations where there's a reduction of flow, or there's pressure, or there's tension. Things can get caught, things can get kinked. This is true about our human bodies. And so, what we're going to be learning today is how to balance our biomechanics. You see, once our biomechanics are balanced, that is the proper movement of each and every joint, then our healing can happen and our pain can go away. You may have seen some of my previous videos on the nerve connection from the body to the brain and back again, and how important that is. Or you may have heard some of my previous work on connection, empathetic connection to our own bodies, our own healing, and the sensations and how important that is. We've even had some talk about the body's cellular renewal systems and how those need to have optimum blood flow and nerve flow for healing to take place. They need to have optimum movement potential, optimum range of movement. So, as we get stiff and tense, and as our range of motion gets reduced, that is the ability to move, that's when we become painful and stiff.
Arthritic.
This is going to get you to where you need to go, your desired state, which is reduced pain levels, improved activity, and more joy with activity, less stress from pain, less worry from your pain. You will not have to worry about using painkillers if you don't want to. And the side effects of painkillers, which are damaging to cells, you won't have to worry about that damage that you might be occurring from the side effects of painkillers. Or you won't have to sign up for surgeries that are unwanted. And finally, your confusion and fear and frustration about the ongoing chronic pain that you're experiencing will go away because you'll be empowered with what to do about it, and your joints will become more balanced, and you'll just feel a lot more alignment in your body. I want to take you from being lost and confused and frustrated, and from being in a position where you might need to take pain meds to get through your workday or to go to sleep, to actually being empowered with this knowledge so that you know exactly what movements to do to incorporate a specific type of orchestration of pain releasing, pain reducing, pain recovering, and cellular healing potentials in your body. How does that sound to you? Right now, I want you to feel your body and to see where the pain might be, to see where you might have some tension. Can you take a minute to kind of go inward and have some, I call, biofeedback moment where you sense something going on in your body. Do you have anything? Right now, honestly, I do have back pain. Since I was a little girl, I used to jump off of horses doing a sport called horseback vaulting. And that made me into quite an athlete, but it put me into a predicament with my joints. Now, I don't know if you've heard this story of me going to my medical doctor because I had knee pain. And I was about 18, 19. And the medical doctor told me that I had arthritis in my knee. And he actually suggested that I stop running. Well, I was quite an athlete at that time. By that time, after all the years of vaulting and jumping off of horses, I started doing soccer and running in triathlons, and I was a swimmer, avid cyclist, and any sport that you put me in, I could do. I was in the dance department, and my dance teacher saw me upset, and she said, "What's wrong? You never like this." And it was because I was very saddened and confused by the prognosis given to me by the medical doctor. Well, she told me right away, well, go see my sports chiropractor. He has helped me very much, and I've been dancing for over 25 years herself. And in one visit, he showed me how to align my joints to balance the biomechanics of my knee joint, which comprises of 3 bones, the tibia, the fibula, those are the 2 lower leg bones, and the femur, the one above. And when those all sat in a proper alignment, I was able to move my knee correctly. And because I was able to move my knee correctly, the arthritic pain went away. Healing happened. All right, here is the spinal curves. This is what the joints of your spine look like in the body. And the bones are here, and there's spaces in between there. That's where the nerves come out. Each and every vertebral body has its proper position, and it's going to have proper motion because of it. Now, as we get to the low back, we have a concavity. That is that slight arching that you see in the low back. Pay attention to that because that's going to help us with function. Now, here is some images of postures. On the far left, that is the most correct posture that we can get. The curvature of the neck is right. There is a thoracic or mid-back curve and a low back concavity. So let's look at the low back of the rest of the postures going from left to right. And you can see there's quite a strain on a lot of them. Some are too flat, some are too straight. They call that military spine. Some are too slouched. And that is exactly what causes low back pain. And that can cause degeneration and arthritis. So now that we have a good idea of the shape of the curves of our spine, the balanced shape of each of those vertebral bodies, particularly in the low back, now we can start our exercises to get those vertebral bodies moving correctly, and we're going to get you balanced with your biomechanics. Now gently go into forward flexion and come up and go into extension. Now, this should not be going into pain, so if you have pain, just stop and come back. This is lateral flexion. Please go to each side gently. Now you're going to have your hand come around the back and pull on the bony process down to the same side that you are leaning to. Now repeat that to each side, back and forth. And for all of these exercises, continue to repeat. But these exercises are only for the low back. There's an entirely different biomechanic sequence for the upper torso and the neck. So let's remember that this sequence that I've shown you today is only for the low back. Now, in addition to doing these exercises for the balancing of biomechanics of your joints in your low back, I recommend that you visit your chiropractor or massage therapist or have an acupuncture treatment to improve the perfusion, that is the blood flow into the injured area, to improve the blood flow into the injured area. And also a great idea would be to swim if you're a swimmer, or to take a gentle stretching class to again lengthen and improve the perfusion, the blood flow into the muscles surrounding your injured area. These are all going to work together, and this is the way to do it. This is the way to get healing to happen without drugs or surgery. This is a way to get you to reduce your pain, and your arthritic pain will go away. And these steps that I'm going to show you are all that you need, I promise you. So let's get started today. You've got some new ones to try. Go ahead and try them, and we're going to build upon them in a progressive way, learning about all the other steps in the next video. I'll see you soon.